Hi everyone. Hi everyone. My name is Kyle Hopkins. In this presentation, I'm going to talk about how healthcare in the United States could be organized and financed in a better way. The main goals are to provide universal health insurance coverage, improve healthcare quality and population health, and slow down the growth of healthcare spending. To achieve these goals, I'm proposing a national health insurance system with a stronger cost controls and bigger focus on primary care. Core proposal. The main idea behind this proposal is a national health insurance model, sometimes called a single payer system. In this system, everyone would automatically have health coverage, and the government would handle most of the financing. Hospitals and doctors would still provide care, but the payment system would be simpler and more regulated. This approach focuses on making healthcare more accessible, fair, and financially sustainable. Universal insurance coverage. Even though the Affordable Care Act expanded coverage, millions of people in the US still do not have health insurance. Many of these individuals are low income adults who live in states that did not expand on Medicaid. Others work part time jobs that don't offer employer health insurance. There are also many people who technically have insurance but are considered underinsured because their plans have very high deductibles or limited coverage, meaning they still struggle to afford health care when they need it. Automatic universal enrollment. One important solution is automatic enrollment in a national health insurance program. Instead of getting insurance through employers or private plans, everyone would be covered automatically based on residency. This means people wouldn't lose their insurance if they change jobs, lost a job, or move away. It would also simplify the system by replacing the complicated mix of private insurance, Medicaid, and marketplace plans. Comprehensive benefits package. Universal coverage should also include comprehensive benefits. This means people would have access to primary care, hospital care, maternity care, mental health services, prescription drugs, other essential services like dental and vision. Another important part is reducing high deductibles and out of pocket costs. Research has shown that when healthcare becomes too expensive, people delay or avoid getting care when they really need it. Providing comprehensive coverage helps improve long term health and financial stability. Financing the system. The system would be financed mostly through taxes instead of private insurance premiums. Possible funding sources could include progressive income taxes and employer payroll contributions. One advantage of the system is that it could significantly reduce administrative costs. The US currently spends a lot more money on healthcare administration than other countries because the system is just so complex. Simplifying the payment system could save billions of dollars each year. Okay, addressing geographic and racial disparities. Healthcare quality in the US is not equal for everyone. A person's race, income level, and even their zip code can influence the care they receive. For example, some communities have fewer hospitals, fewer doctors, and fewer healthcare resources. To address this issue, the healthcare system would provide more funding and support to hospitals and clinics that serve disadvantaged populations. Tracking health outcomes by race and location can also help identify and reduce disparities. Maternal and gender disparities. One major example of healthcare inequality is maternal health. Black women in the US are about 3 times more likely to die from pregnancy related complications compared to white women. Policies to address this problem could include national safety standards for maternal care and extending postpartum health care coverage for up to 1 year after birth. These changes can help reduce preventable deaths and improve maternal health outcomes. Global hospital budgets. Another way to improve the system is by changing how hospitals are paid. Currently, hospitals are often paid based on how many services they provide. This system encourages higher volumes of care, which can increase costs. Instead, hospitals could operate under global budgets, meaning they receive a fixed amount of funding each year. This encourages hospitals to focus on efficiency and patient outcomes rather than just the number of procedures they can perform. Strengthening primary care. Primary care plays a huge role in improving population health. Countries with strong primary care systems tend to have better health outcomes and lower healthcare costs. The US should invest more in primary care services, including preventative care, care coordination, and patient centered medical homes. Strengthening primary care can help catch her health problems earlier and reduce expensive hospital visits later. National quality standards. Improving healthcare quality also requires national standards. This can include evidence based treatment guidelines, better sharing of patient data between providers, and public reporting of hospital performance. When hospitals and doctors are held accountable for quality outcomes, it encourages improvements in patient care. The cost problem. Healthcare spending in the United States is growing much faster than the overall economy. Research shows that the Americans don't necessarily use more healthcare services than people in other countries. The main difference is that prices in the US are much higher. Hospital services, doctor visits, and prescription drugs all tend to cost significantly more than they do in other developed countries. National price negotiation. One solution is national price negotiation. Under this system, the government would negotiate prices with hospitals, doctors, and drug companies. The goal would be to set fair prices and limit annual increases so they grow at the same rate as the economy. This type of system is already used in many other developed countries. Pharmaceutical reform. Prescription drugs are one of the fastest growing parts of the healthcare spending. Policies that allow the government to negotiate drug prices and use international reference pricing could help reduce these costs. Other developed countries already use similar strategies to pay much lower prices for the same meds. Administrative simplification. Another major issue is administrative complexity. Doctors and hospitals spend a huge amount of time dealing with insurance paperwork, billing systems, and prior authorization requirements. Simplifying the system with a single claims process and standardized billing could reduce administrative waste and save hundreds of billions of dollars. Capital budgeting. Capital budgeting is another strategy to control spending. This means that large investments in hospitals, equipment, and new facilities will be planned more carefully at a national level. By preventing unnecessary duplication of expensive technology, the system can control long term healthcare costs. Value based payment. Healthcare payments should also focus more on value instead of volume. Programs like bundled payments and accountable care organization reward providers for improving patient outcomes while controlling costs. This encourages healthcare providers to deliver care more efficiently and effectively. Expected outcomes. If these policies were implemented together, they could achieve several major improvements. First, everyone in the US would have health insurance coverage. Then, healthcare quality and health outcomes could improve, especially for disadvantaged populations. And then we also have how healthcare spending growth could slow down so it matches the growth of the overall economy. Conclusion. So, in conclusion, the US healthcare system can be improved by adopting a national health insurance system that provides universal coverage, regulates prices, and strengthens primary care. These reforms could help create a healthcare system that is more accessible, more equitable, and more financially sustainable. Thank you.